it kind of makes me mad. I told my coworker once that she could eat some of my cheese, and now she has been eating the fuck out of it. Man, it just makes me mad because it's just like, this is why I can't have nice things. I can't even keep my cheese on the fridge.
Hey, what's up everybody? My name's Kanabi. I haven't uploaded a video for a dental assisting in a minute. I do a lot of different kind of content, whatever. If you want to go watch, go look at my videos, like, subscribe, you know what to do. So anyways, this video is going to be a tips for dental assistants part 2. I had to really think about this for a long time, and also if you have any suggestions or questions about dental assisting videos you want to see from me, please leave them down below and I'll figure out how to do them. If you want to see a certain video from me, please don't hesitate. Leave it down in the comments. Let's get started. And if you're wondering why I'm looking down, I have it written down in my little book. So, tip number 1, make sure you change the mouth mirrors, you wash them, and always when you're setting up, never give the dentist the dirtier mirror. You take the dirtier mirror, you give him the one that's more like clear so he can see better. It doesn't really matter if you have the dirty one. It's even a good thing to just kind of like put it in the ultrasonic, or if you're not using the ultrasonic, like wash it with like a little paper towel and then put it in the autoclave, because then that way the autoclave doesn't like harden whatever kind of crap is on the mirror, because that's when the mirror starts to look all nasty and crusty. And some people will say something, they'll be like, is that mirror clean? Just make sure you're changing the mirrors, because you wouldn't want somebody to use a nasty mirror on you, and you wouldn't want to do that to your mom, your dad, or like your family. So yeah, just keep that in mind. I always recommend set up the rooms and the trays before the day comes. Like if you already can kind of see the schedule ahead of time, like say treatment is on a Friday, set up the trays on like a Wednesday or a Thursday and have them in the cabinets or wherever you put your trays, so then you can just be ready. But also you have to have enough setups too, so it's just better to be prepared. And then I always like to set up the rooms the day before instead of the day of, because it's so stressful when you have to run and set up everything. So much easier when you get there, everything's ready. There's no way I would have time to set up in the morning. There's just no way if I showed up earlier, but who's gonna unlock the door? Set up the treatment trays before, days before if you're able to, then set up the room the day before, so when you get there in the morning you don't have to like hassle to the office to like do all the rooms and get them ready, because like it doesn't hurt if you do it ahead of time. It's not going to be that bad, or even if you work at like a general practice, you can have things set aside that are certain setups, so then you can just grab them and go. Like for example, if an emergency happens, it's good just to have kind of like I guess some things it'd be harder to do, like root canal, because there's a lot of stuff. But if you're able to do like a general kind of like filling setup and have it set aside, and like a crown prep setup and things like that, it'll just make time go by. So just keep that in mind. It's just to make your life easier pretty much, because I know as a dental assistant we already do so much. We're already so busy. We're pretty much running here and there. You need a break anytime you can get one. You really do. If an appliance is loose, a bracket is broken, or if a patient comes in having pain on a certain tooth, don't wait for the dentist to tell you. Start setting up the room, get it ready, take the x-ray if they're having pain on that specific tooth, take a PA, a periapical, and maybe even a bite wing too. But PAs in general for like you want to see if there's an infection in the root and stuff. So just go ahead, take initiative, take action. The dentists, they love it. And then obviously for the appliance being loose, you would obviously just go get everything to re-cement the appliance, assuming that you're going to. And then if you don't, it's no big deal. You can just put everything back because you didn't use it. So, or you can just sterilize it anyway because it's not a big deal. So anyways, that was number 3. Let's go to number 4. This is a stupid one, and this would happen to me a lot in the beginning, and I feel like the other assistants would like make me feel bad for making the stupid mistake. And it's not even that big of a deal, honestly. Before you take the x-rays, just simply take a peek at the name on the chart. Make sure you're in the right person's chart. It happens sometimes when you kind of take the wrong x-ray in someone else's chart. In some programs it can probably be a little bit more tricky, but in EagleSoft, which is what I use, which we actually have 2 programs, we use EagleSoft and Dolphin. Dolphin's for ortho, EagleSoft is for like hygiene and stuff. EagleSoft is a popular one. On the x-ray part, you'd like, I think right or left click depending on whatever the mouse thing's set up to, and then it's gonna say transfer to, and then it's gonna ask you like, is the patient profile open or something. That's how you do that in EagleSoft. Oh yeah, the dentist will get mad. Sometimes you'll end up going and looking for the x-ray because sometimes you'll just do it and you won't even realize it. I did it before. And then I'm like, if you end up taking an x-ray in the wrong patient's like file or whatever, and you don't realize it, which this has happened to me, you end up looking for the picture because you're just like, I don't even know who I took it under, you know? And it can get tiring when you've had 20-something patients. One day I swear we were looking at somebody else's teeth that it wasn't even the kids. I'm like, it happens to everybody. Don't be too hard on yourself, you know? 5, this is just an in general for any job. Leave earlier than you think you will need to because you'd always rather be early than late. And then sometimes I'm driving and then it's like, there's a wreck on the highway or something and I'm like, that's just lovely. Make my day. And then I'm always, you know, hoping that it's not like really bad and then it's not gonna take long. And hoping that, you know, the people are okay, but what do I live in? New York? Always leave before you think you should because you're gonna encounter something that's gonna run you late. You're gonna probably have to go through school zones maybe. There could be wrecks, just unknown things. I don't know about you, but I drive a Honda Civic. It gets dangerous when it rains a lot. I'm not gonna lie. Because I have a small compact car. It's just like, it's not good. So then that'll slow me down, and then definitely sometimes when it's raining pretty bad, I have to get off the highway and just take like the service road because it gets to a point where it's like cars, your windshield wipers can't go fast enough. And then there's giant trucks, like monster trucks I'm talking. Like I live in Texas, so of course, yeah. There's freaking monster trucks and they're backsplashing all this water on you and it's like, I'm going to die on my way to work because I'm in such a rush to get there. So yeah, just leave early. Don't risk it. Plus, I mean, at the end of the day, it's your bag. It's not theirs, you know, it's your money. So step outside your comfort zone because it will be so rewarding. If you were able to do the things that you don't like in dental assisting, whatever it may be, maybe it's doing crown prep or doing impressions, fitting things to teeth, or like, I don't know, iTero scanning, whatever it may be, jump in the room more often and do it because the more you do it, the better you will get at it. And then you'll realize, oh, I don't know why I was so stressed. And then a lot of things will come more easy to you. And the dentist will see that and they'll give you a raise. So just keep that in mind. It's a random tip. This is number 7. Always carry a pen with you just because, well, you're bound to need one because I don't know about you, but I'm always writing down stuff, whether it's blood pressure, their weight, height, and then just marking things when the exam is happening, going over the stuff with the dentist, marking and like doing the like physical charting. So just keep everything in mind. So yeah, just keep a pen with you because you're gonna need it. So just keep a pen with you because you're gonna need it to write like pretty much everything. So yeah. I know it's a basic tip, and another thing I even kind of wrote down was like have like a Post-it or like paper with you or like a pen and pad. You don't really necessarily need the paper because you're probably gonna be having like some kind of paper that you get from your like doctor. But then again, when I was in general, we didn't have papers for things like that. It was like everything was done on the computer and it was all digital. I would say if everything's digital at your office, definitely have a pen and paper because at my old office, I definitely carried one. Number 8, have at least 2 pairs of scrubs just because you could spill bleach on them, get pin stains on them, and it's just good to have extra ones just because anything could happen pretty much, you know? I had some scrub pants for some reason, like the inside of the thighs were like, I don't know, it's kind of like how leggings get after a while, and then I had to get new ones. I'm hoping the new ones don't do that, but I don't know. Maybe it's because I like have thunder thighs, maybe. It's not a bad idea just because you're bound to drop something that's gonna stain them and it's not gonna come out when you wash them. As soon as the patient comes back, start the note. God, I swear, you can even start the note as soon as they get there if you need to. Like, if you already know what the note is about, you already know what you're gonna do, just go ahead and start the note, put the blood pressure in. It will just help you out a lot. It sucks whenever you have to do things later. You'd rather just do it then, get it over with. Like, at the old practice that I worked at, it used to annoy me because, like, doctor would come in literally after, like, I swear, 30 seconds to a minute after I brought the patient back. I barely even had time. It may have been even like, I swear, 10, 20 seconds actually. Or the doctor would just come in and then start asking all these things and he'd be like, you didn't start the note already? I'm like, I just brought them back. I hadn't even put the bib over them yet. Like, and I'm like, I hate this place. I would say if you have like valuable information for the doctor that would help them save money or just like help them in general. For example, at my old practice, we had this stuff called like a surgical milk. It's actually for tools that pretty much have the hinge mechanism. So it literally looks like milk. It's water-based, so you're able to put it in the autoclave. You literally just dip the tools in for like 30 seconds or longer if you want. It's not gonna affect the tools in a bad way. Then you just bag them, or, you know, I guess depending on how you keep the tools, bag them or not, depending on how you do that. You put them in the autoclave, sterilize them, and yeah, they come out good. And it just helps prolong the life of the tools and keeps them nice. And like, we used to have a lot of tools that were literally like, a good majority of them were like hard to open because they were kind of like, I don't know if rusted is the right word. Maybe you can go tell your dentist that information now. But it's literally white, looks like milk, and the way you use it is you pretty much you do 1 part surgical milk and then 5 parts water. So it's pretty watery, which is good because then it makes it like last longer. And of course, like there's a lot of different dental products that you'll come across. So you'll come across some really cool ones that are like, wow, why doesn't every office use this? But it's like the simple thing is they just don't know about it, or maybe they just don't want to spend the money. Who knows? Some of these dentists are pretty cheap, so keep that in mind. And you know, the more you know. Be nice to everybody, even if they are annoying. And I guess I was probably meaning the patients, I don't know, because I work with kids. Some of these kids are a trip though, like literally you'll be talking and they'll be talking so much. It gets to the point where I'm walking away and I'm still hearing them talk and I'm like, they just won't stop. Like, I'm not even in the room and they're still going. I'm like, wow. Like, are they just not seeing me walk out? They're just so in their own world. Like, I don't know. If you really need to take a day, don't feel bad. Take a day. Your mental health just like matters more than anything. And like in 2 to 5 years, you probably won't even have this job. And honestly, there's dental temp agencies. There's cloud dentistry. There's a lot of different places where people can actually like, get help. So don't feel bad. Yeah, so don't feel bad if you need to take a day. Take the day. You need to relax. You need to like figure out your life. You're going through something. If your job wants to fire you for taking a day, for a personal day that you need, and you should be able to take days off whenever the hell you need, without any explanation, you know? You can always find another job. And you can always temp in the meantime, and you'll probably make better money. Just keep that in mind. And then the thing with temping is you get to decide when you work and how much you work. I hate to say it, and don't take offense to it, but the craziest dental assistants that I've met have been like temp assistants that have been hired permanently. And I mean, which I mean could be anybody, but I've had some pretty crazy stories with at least a few temp assistants. Recently, you know, it kind of makes me mad. I told my coworker once that she could eat some of my cheese. And now, I like had a bag of cheese up there, and she has been eating the fuck out of it. Man, it just makes me mad because it's just like, this is why I can't have nice things. I can't even keep my cheese on the fridge at work. What is this democracy? I'm only allowed to have ramen noodles and dried up macaroni in my locker. Bring a lunchbox, put your stuff in there, and you know, if you're gonna tell somebody that they can have a piece of something, don't let them help themselves. Give it to them physically. I know, it must sound ridiculous, but why I'm so mad is I am so hungry right now. Well, I'm broke, so I can't like buy anything for lunch when I'm at work. How can you eat my cheese? I told you once that you could have some. And now, you're eating it all the time. So, you know what I did today? I put my cheese in a Ziploc bag, right? I thought that would deter her. No. She still went into my bag, unlocked my Ziploc, and took like 2 or 3 pieces of my cheese and ate them all. And now I like counted, and I'm like, I swear to God. So you know what I did today? I got a white paper bag. I got my cheese and my yogurt, and I put it in a bag. I'm honestly kind of mad because I looked like one was missing. And I'm like, are you kidding me? I can't have anything. It's like, why don't you buy your own cheese? I just don't get it. Oh, man. I'm low-key upset. I wish I would have brought it home. I'm so hungry right now. It's stupid. My stomach is like going nuts. But I made coffee. I have a Dr. Pepper somewhere. I have chips that I could eat and, you know, cereal and other stuff. It's just like, I've done so much. I don't want to make any food right now. Yeah, so bring a lunchbox. Protect your food from your coworkers. Bye.